Hi, good afternoon. My name is Nuno, and I'm one of the directors at Nightingale Hammerson, a charity based in London with the mission to deliver residential care to the older Jewish community. And currently, with the Reach by Nightingale Hammerson project, we are extending our remit to support people to live better for longer at home. And one of the ways we will be doing it is by providing free information, free practical advice for free to the world. And in this case, today we are doing our fourth webinar regarding the topic of end-of-life care in the three Abrahamic religions, so in Islam, Christianity, and Judaism. And with us, we have Professor Mark Clarfield that will introduce a bit later. I'll just like to highlight that this session today is being recorded, and the video is going to be available on YouTube in the next few days to make sure that as many people as possible have access to this extremely valuable information. There will be a time for question and answer at the end of Professor Clarfield's speech, and you can do it in two ways. The first way, you can write on the chat and we'll read the questions at the end. Or second way, you raise your hand and we will introduce you to ask your question directly. But that will be at the end of Professor Clarfield's presentation. I would also take the opportunity to invite you to follow Reach by Nightingale Hammerson on YouTube, LinkedIn, and Facebook, where you can get the updates of all the important information we are sharing for free with the world. So without further ado, I'd like to introduce you to Professor Mark Clarfield, that is currently based in Israel. He's a geriatrician with a very extensive knowledge around the provision of the geriatric care, but also end-of-life care. And he brings a very good perspective from all the three Abrahamic religions. I'd also like to highlight that, unfortunately, today, the main teaching hospital of the Ben Gurion University has been hit by a missile this morning. That's the hospital where Professor Mark Clarfield works. Our thoughts are with you, Mark, your family, and everyone affected by this terrible situation. And, thank you also very much, despite everything that is going on, you are still here and helping us to spread the word and spread the knowledge to help thousands of people in the UK and worldwide. So we are bringing now Professor Mark Clarfield on the screen because of the situation where Professor Clarfield is at the moment. He's on camera in there, but at certain points he might switch off the camera, so we ensure that the quality of the sound and image is the best. Mark, thank you very much for joining us, and please, the stage is yours.
So if I could have the first slide. Thank you so much for the kind invitation. That's me, sort of. Let's hope for a speedy end to the conflict in which we're involved right now, and the civilians on both sides, both in Israel and Iran, don't deserve any of this. So let's hope for a speedy end to the conflict. It's a little hard today, given what's going on and what I've been through, to make the switch, but I'm going to do my best and keep at bay for the next hour what's going on around me for your sake. And that is that this really is a very good story. Could I have the next slide, please? That brings me to this talk. I met these, under my name there, you'll see three colleagues, Gordon, Markwell, and Alibi. And this is a little bit like the old joke about, a Jew, a Christian, and a Muslim go into a bar. Because we actually were sitting around having coffee and started talking about end-of-life care and the challenges that we met in the Jewish people, the Christian people, and Muslim people. And from that came this kind of discussion, which I'll add for you today. And as you can see at the top, I don't have a pointer, but it says JAGS, Journal of the American Geriatric Society, 2003. You can look it up, and if you can't find it, send a note to Nuno, or I'll send you the article. Next slide, please. So really what we're going to talk about is the cultural influences that occur at end of life, death and dying, And I won't read, you can read just as well as I do, but just slide your eyes down to the bottom. We're going to concentrate on religion as a subset of the cultural issues that affect end of life care. Next slide, please. So I'm going to try and answer two questions. First of all, what does end of life care have to do with older persons? And I think it's probably obvious to most of you. And the second, more important, and what we'll focus on is what's the effect of religion as an example of culture on these issues. So many of you might think, especially living in the UK and in Northwestern Europe, that religion is passé, that people aren't religious anymore. When I was on sabbatical in the UK a few months ago, I went to a lot of concerts in a lot of churches, most of which have been decommissioned. In other words, people in the UK don't go to church anymore, or not, certainly not in the levels they used to. But that's not the case in the rest of the world. The majority of the world is actually quite religious, not just in Israel, but around the world, except for Northwestern Europe. Next slide, please. You can see it's a little hard to see, but this is an answer to a question of Christians. Religion is very important to my life. Percentage of people agreeing. You can see the darker the color, the more people agreed. So you can see that sub-Saharan Africa is answered very positively. So too did most of South America. So too did the United States. A lot of Christians think that religion is very, very important to their lives, as do the other religions. But this is just some data from Christianity. Next slide, please. And also, these issues are relevant. Religion and health are relevant. Here's a study from the Journal of the American Medical Association that conscripted Christian religious leaders to encourage male circumcision in Tanzania in order to reduce the incidence of HIV infection. And in fact, they found that they were able to raise the level of circumcision, which protects against AIDS, via the use of priests to speak to their flock. Next slide, please. It should be an example of my neighborhood. This is my neighborhood in Jerusalem. And as you can see, 6 different rabbis basically saying in Hebrew, look, this was during wars, look after yourselves, meaning follow the directions of the medical authorities, wear a mask, get vaccinated, social distancing, etc. And you can see we use 6 different rabbis in order to reach from different sub-communities of the Orthodox communities in Israel, in order to reach the widest possible group. And these campaigns had a positive effect. Next slide, please. In Canada, Christian doctors are questioning, using Christian religion as a support, are questioning the government's wisdom in promulgating laws in support of MAID, medical assistance in dying. And I know that this is a big deal in the UK just now. You're debating it as well. And so Christian doctors have weighed in as Christians on this debate. Next slide, please. Sometimes I slip. I'm going to be talking about the role of Jewish law, or the position of Jewish law, Catholic law, and Islamic law on the questions that I'm going to ask in a few minutes. And sometimes I slip and I say Jews or Christians or Muslims. Not all Jews avoid cheeseburgers. Not all Muslims avoid alcohol. Not all Catholics avoid abortion, but we know what those religions have to say about those. So we're going to talk about what the religions have to say with the assumption that it has some influence on the adherents. Slide, please. And the final caveat, of course, is I'm not an expert in theology. So I know a lot about theology within medicine, but I'm not a theologist. So I'm going to present a clinical scenario to you that will probably be familiar to many of you if you're in the caregiving, nursing, doctors, social workers, etc. And we're going to ask a few questions, what you think about it, and then I'm going to tell you what Jewish law, Catholic law, and Islamic law has to say about these questions. That doesn't mean that Jews, Christians, and Muslims do what the laws say, but what the laws say. And when we're not going to talk about secular law. So the scenario, I'll read it to you. I don't know how well you can see it. It's an 86-year-old cognitively intact woman, has a major stroke, and for 2 months she remains unconscious with complete hemiplegia. The chance of her significant neurological recovery is nil, 0. She has no advance directive, and her Jewish family have strong religious convictions and request a permanent feeding tube. While this discussion occurs, she becomes febrile and is diagnosed with COVID pneumonia. And let's just make the situation even more interesting. It's during the COVID pandemic, where there aren't very many intensive care unit beds or ventilating machines available. The children, they insist that the doctors must under no circumstances tell the patient's elderly husband her bleak prognosis, because, quote, the children claim, this information would surely kill him, end of quote. He himself, the husband, the father of the children, is cognitively intact and every morning keeps asking about his wife's condition. Now, I can't see your faces on the screen, but when I give this talk in person, I usually see people kind of smiling and nodding, and probably, I hope some of you in the audience are quietly smiling and nodding, meaning that you've seen this, you've been to this movie before, as we say in Hebrew. Next slide, please. There we go. And this is just the two ways you can feed somebody artificially. No, go back, please. Yeah, you can put it through the skin of the abdomen and stomach, or you can put it through the nose of the stomach. And both of these are uncomfortable and invasive. And the children, that's not simple to do. It doesn't mean we shouldn't do it, but it's not simple. It has complications. There's a lot of just writing about whether we should or and to do this. Next slide. Very good. Thank you. 3 questions. Is it appropriate? I'm going to ask now what the Jewish, Catholic, and Islamic law have to say about these. Is it you in the audience can think what you think, whether or not. 2, should we treat her pneumonia? And now, given that it's COVID, should we use one of our last items for care, or should we offer her palliative care? 3, what husband when he asks these questions? The children are any truthful information about their mother's bleak prognosis will kill him. Next slide, please. Next slide, please. I guess you're frozen again. Oh, there you go. Okay, so what should we do? How do the 3 religions handle this? Next slide, please. People are writing, the sound is not good. He's breaking up. Okay, I will try and speak more slowly, and I'll let Ariel and Nunu decide whether to go on or not.
Yes, the sound was not great for a moment, but now it seems to be better. So please carry on. If we need to stop at any time because the sound is not good, I will let you know. But you can carry on.
What slide could you go over?
So it was the slides related to the questions, the 3 questions you had.
Let's go back. They're important, though.
Okay.
Let's go. You could read them. Was it okay? It's okay to move ahead?
Yes, we can read them. So we could read the questions. So
you just read them, and just go ahead. I won't even talk. You can just read them.
Fine. So question number 1.
Probably read them before.
Is it appropriate to insert or refuse to insert a feeding tube in this patient? Question number 2, should her pneumonia be treated, and how? Is it in intensive care unit or only offer a palliative care treatment? And the question number 3, how should one respond to the husband's queries?
Thank you, Nunu. Okay, go ahead, please. Next slide, please. Next slide, please. Okay, so what happens, the 3 of us got together, these 3, the Jew, the Christian, and the Muslim, and we looked at the various religious traditions, and we answered what those religious traditions would tell an adherent to do vis-a-vis those questions. So next slide, please. Okay, so in order to answer this question, you have to know at least what the secular ethical approach is. And you probably know this. There's a respect for autonomy. People make up their own minds about their bodies. The next principle is justice or distributive justice. How do we give away scarce resources? There's only 1 ICU bed left, and there are 5 patients with COVID that need it. A 3-year-old, a 13-year-old, a 30-year-old, and a 103-year-old. Next slide, please. And then we in secular ethics, we're concerned about beneficence, doing the right thing, giving someone antibiotics and vaccinations, non-maleficence, which is to do not to hurt people knowingly. Next slide, please. So if you try and synthesize these 4 principles, you find that in Western culture, including the UK, autonomy trumps beneficence. In other words, if a person says, I don't want you to do this to me, and you, the doctor or care system, think it's good for them, their autonomy will overcome your willingness to help them. You can't help people that don't want to be helped. In other cultures, more traditional cultures, low-income countries, we see that beneficence and paternalism often trumps autonomy. And in the three Abrahamic religions, that's the case on the right, on your right, which is that beneficence trumps autonomy, is the tendency of Orthodox religions. It doesn't always mean that, but that's their tendency. And the tendency of secular societies is the diagram to the left. Next slide, please. Slide, please. There you go. So what do these religions have to say about the clinical? So here are the three religions. Oh, no, go ahead. That's fine. That's fine. Next slide, please. Here are religions, and here's the sources. You know, there's only 13 million Jews. There's a few more Catholics and a few more Muslims than Jews. We started first about 3,500 years ago. The latest kids on the block are the Muslims at 600 Common Era. And under the sources, I won't read them to you. These are the religious sources that rabbis and priests and qadis and imams look at when people ask them questions of the kind that I presented to you with this particular clinical scenario. Next slide, please. Slide, please. Okay, just to remind you, I won't read it to you if you've forgotten this scenario already, with everything that's going on. Bad stroke, very little sense of recovery, no advance directive, feeding tube, pneumonia, and the children saying, don't you dare tell my father how sick my mother is. Next slide, please. Here are the three questions. Remember, we're now going to not answer from secular point of view, or even what you or I think, but rather what do the three religions say when you ask religious authorities the answer to these three questions. Next slide, please. Here you go. This is the summary slide. So with respect to feeding tube, the Jewish religion and Muslim religion agree with an exclamation mark. You must feed a person to the very end. Food, water, and oxygen are not medications. They are ordinary therapies. According to Catholicism, they can be considered extraordinary therapies, extraordinary, meaning you don't have to do what is extraordinary. So there are Catholic authorities that would say you don't have to give her a feeding tube, while Jewish and Muslim authorities would definitely insist on one. The second question about pneumonia, the Jewish religion and Islamic religion say you must treat her pneumonia. The Jewish religion has a kind of catch, and it has to do with the word goses, which in Hebrew is kind of roughly translated as the end of life, right at the end, when the death rattle is to be heard. When someone is just about to die, there are injunctions in religious Judaism that whilst you must not extend the suffering that comes with death. That concept does not exist in Islam, and it's kind of confused in Catholicism. With respect to the husband's query, should we tell him the truth or not, both the Catholic religion and Islamic religions are emphatic that you must always tell the truth. Again, it doesn't mean that all Catholics and Muslims always tell the truth any more than all Jews avoid cheeseburgers. But that's what the religion says. In Judaism, in Jewish law, you should tell the truth. However, there is an out, and that is that if you, the professional, actually believe that telling the old man his wife is very, very ill would indeed kill him, you don't have to tell him. However, that's what the religion says. It does not encourage doctors and nurses not to tell the truth. It does give them a little bit of wiggle room if indeed professionally you think it will kill him. It's not enough that the children say that. It's not enough that children threaten you. And I've even been in such situations where I've been threatened by children. Not necessarily with physical violence, but in a threatening way. Don't you dare tell my father, my mother's bad prognosis. So that's a very short, simple distinction comparison between the three religions on these three questions. Thorny questions. Pardon. Next slide, please. Oh, very good. With respect to feeding, this is not thing to see. You can see people being spoon-fed. I'm now jumping in the case where the woman has a
Sorry, the sound
dementia.
is,
We'll have trouble. Yeah, yes,
the
sorry.
sound is failing again. So if we can just go back a couple of slides
Sure.
to where we had the feeding tubes, the slide with the feeding tubes. That's it. Let's see if the sound works better now, Mark, if you don't mind.
Very good. Just to remind you, there's two artificial ways of feeding people, but let's talk about an end-stage dementia patient where, next slide, please. Next, there's an alternative. You can feed a patient with a stroke, but dementia patients could be spoon-fed. This takes a lot of time and energy, but it can be done. So there are alternatives sometimes that are acceptable. Can you still hear me? This is a little hard to see. It just along the left, you can see different ethical principles. And on the right, you can see how Judaism, Catholicism, and Islam differ. The dots and dashes, I don't have time, nor can you hear me well enough for me to explain, but I think you can see the heterogeneity involved in this graph. And in the article that I alluded to, if you're interested, you can go back and read it and you can see this graph. But just to see the different dots and dashes, you can see the religions differ quite a bit on these different issues. So, for example, move your eye down to autopsy near the bottom. And you can see that 1 star, 1 asterisk means unacceptable. 3 means perfectly acceptable. Thank you, Nino. Yeah, 1 star, 3. Excellent. Thank you. So for autopsy, Judaism and Islam are very much against post-mortem examination. Catholicism is absolutely neutral. If the doctors think it'll help, go ahead and do it. There's no religious injunction not to. So that's just another example. Next slide, please. So I think I've tried to answer a couple of questions for you, looking at how the 3 Abrahamic religions approach it, not necessarily how Jews, Muslims, and Christians present it, but how their religious sources approach these questions. Next slide. Next slide, please. Interestingly enough, if you're interested in the Jewish side of it, this pamphlet, Choveret, how do you say that in English? This workbook was just published, and you can look it up. It's called Sohar. That's an organization of religious but progressive rabbis, quite religious, but they live in the modern world, and they've dealt with a lot of the difficult questions in health and medicine from the Jewish point of view. I wrote to my Catholic and Muslim colleagues the other day and asked them if there was such a pamphlet that related to Catholic or Islamic law, and my Muslim friend wrote me back and said there isn't. In fact, the differences between Shiite and Sunni approach to this are very, very large. So you can't really talk about Islam. I've talked about Shiite until today because our expert was a Shiite Muslim. The Zohar Choveret, you can just look it up. One of the rabbis answered, if you Google them in Hebrew or English, Zohar ad 120 until 120, you should live to 120. You should be able to find it. And you can send them an email. They'll send it. It's a wonderful document. It's in Hebrew and English, whichever language you prefer. Next slide, please. So for further reading, there's the article that my 3 colleagues, it says Clarfield et al. JAGS 2003. That covers what I covered in this talk. And then in the CMAJ, the Canadian Medical Association Journal, in 2001, there were a series of 18 articles on medical ethics in all of the major religions of the world. There are 18 articles for free. And I just give you here the ones on Judaism, Catholicism, and Islam. But you can look up there's Sikhism, there's Buddhism, there's Hinduism, there's all kinds of other religions, and they're quite interesting to read. Next slide, please. So I want to thank you. Toda rabah, merci beaucoup, shukran. This is a picture of my grandparents on my mother's side. My grandmother who died at about 70, which back in 1950 was considered quite old or old enough, and my grandfather, who outlived her by 51 years. He died when he was 111. So he made it not kimat ad mea vesrim, almost to 120, but not quite. And right, you can see on the slide, if you have any complaints, you can write to me on my email. It's right there. And the CMAJ articles are for free. Just go into the Canadian Medical Association Journal website. Okay, I hope I kept to time. I hope you were able to understand me. And maybe, Nuno, should I try the camera and see if you can see my punam or not? What do you think?
Mark, thank you very much for the presentation. It has been fantastic as always. We had the opportunity to have Mark live in London a few months ago when he was here, and obviously live is better. But we still thank you so much. With everything that is going on, you still were able to do the presentation to us. If your camera works, perfect. If it doesn't work,
my pleasure.
It's not an issue. Now is the time for questions from our audience that you can either write them on the chat or raise your hand.
I'm going to turn it off to keep the sound better, I hope.
Yeah, it's better maybe to have it off. So yeah, we welcome questions from our audience. Feel free to write them down or raise your hand and you can ask the questions. It's always extremely interesting to hear the differences and the similarities actually between the three religions. And when we had the presentation from Mark the last time, it was quite interesting to see the similarity between the Judaism and the Islam, which was quite interesting in the approaches. So one of the questions that came up at the last presentation, and if you don't mind, I'll open the stage by repeating a question that you answered back in London that is related to the topic and the case you presented about the families and the different perspectives from the families in the care of someone that is dying in terms of the medical interventions that should or should not be done. So there's the family side and there's the medical side of what you feel is the right, or medically what is the right treatment to that person or not. So in circumstances like this, Mark, and I know you are bringing an international perspective to us in the UK, which is quite helpful. What would be the right approach when you have a family saying treat, and when you know from a medical point of view is not beneficial to that person that is dying to receive that treatment or that medical intervention?
I'm going to put my camera on for a minute. Don't do this. In other words, you start with the family and say, look, we're on the same side. We're on the same side. I want what's best for your mom, and so do you. So the natural reaction is, who the hell are they? I've studied medicine. I've been a doctor for 40 years. What are they telling me what to do? You've got to get rid of that. That's so last, as my children say, that's so last century. In other words, you have to come where they're coming from. So that's the first thing. The second thing is, this is a process. It's a marathon. It's not usually a sprint. You usually have days and weeks, months, or years to deal with this stuff. Sometimes there are moments where you have to make a decision quickly, but they're the minority. So take your time. If you can't come to an agreement on day one, you'll come to an agreement on day 3. The third thing is, try and understand as much as you can about where they're coming from. In my case, if they're religious Jews in Israel, I can make a bunch of assumptions because I live in this world. But I may still be wrong in my assumptions. So I always like to say, well, tell me, why do you think this is right or wrong? Why do you think we should do X, Y, or Z? And they'll say, and they'll give you an answer that's factually incorrect, for example. They have the facts wrong, so you have to explain the facts. They'll say, because my rabbi told me that we have to do this. And then you go, okay, would it be okay if I spoke with your rabbi? And in most cases, they'll be happy to have you speak. And some religious Jews it's less the case with religious Muslims or religious Catholics, but it does happen, are sometimes very dependent on the opinion of their rabbi. And so you might have to work through a third party, which, I've done that many times and it's been fine. But I think the main thing is this isn't a conflict. This is a negotiation to do the best thing for your mom. And in secular societies like the UK, you always in the end have the law on your side. And you don't pull that gun out at the beginning. You don't say, listen, I can do whatever I want. I'm the doctor and the law says X, Y, and Z. And just because you think A, B, and C doesn't make me want to do it. That's the kind of, I hate to use the analogy of an atom bomb because we're right in the middle of a war because of that, but that's the nuclear solution. You don't want to use that. But sometimes you have to do it. So it's a negotiation. It takes time. And bring in other people. Bring in the rabbi, bring in the social worker, bring in a family, and take your time to solve it.
Thank you very much.
Done.
It's very, very good reply and very diplomatic as it should be. And we've got a comment/question from Julie Stewart that she's based at the NHS in London that says, Muslim family, 86 years old patient with advanced dementia reaching end of life, still for cardiopulmonary resuscitation. Help. What is your comment about this situation?
Okay, so again, I'm not such an expert on Islamic law. I would know what to say about Jewish law, but I think you do the usual things where you try and explain that bringing mother back after cardiopulmonary resuscitation, if it's successful, will not make her better than she is today. It'll make her worse than she is today. She'll be worse if she lives. The second thing you can say is, who's telling you, why do you think this? And see if they can bring in a religious authority. And then finally, sometimes you have to do stuff that is futile. Sometimes the craziest thing to do is to run, I know this sounds terrible, but I've learned over time, is to run a slow code. What's a slow code? A slow code, the medical ethicist will tell you, you can't do this, but I'm a doctor and I work at the bedside. I tell them, we'll do CPR, we'll do what we can. You pull the drape shut, you do CPR, not badly. I mean, you don't pretend to do it, you do it, but you don't do it for 20 minutes and you don't use every drug under the sun. And then you say, after 5 minutes, we tried. I know that might outrage some of the people in this audience, but it is a pragmatic, practical, war-avoiding solution if the other solutions that I suggested don't work. Has the questioner been able to get into their heads? Does she know why they think this? Are they using religion as an example, or they're just saying that's what we do for our older people? Could we throw the question back to I just like some more detail if possible. Religion. Okay, so you know what? Ask them. Muslim religion does not, I can tell you, the little I know, it doesn't insist on CPR for people who are profoundly demented. Try and get yourself a religious authority, a family or doctors. Julie, you're in trouble. What can I tell you? You may, I don't know the answer to this. It may be, and look, I have children, and they're doctors and they're Muslims. You're in trouble. You might just have to do it. If nothing else works. Indeed means, yes, you agree, or indeed, that's what you have to do.
Yeah, very, very, very good in the sense live scenario of experiences that our professionals
thank you for that. That's a tough one.
Yes, a very tough one.
Hold on, Julie, you're not in trouble. The family is. You're not in trouble. You're doing your best on the bottom lines, trying to avoid unnecessary harm to this lady, and the children might just be the ones that are making you do it. And sometimes you can't avoid it. Try, but you might not be able to avoid it. And don't lose sleep over it. You didn't do the wrong thing. Medicine's a dirty business.
So the last question, because we need to to end in the next couple of minutes is related to CPR, so resuscitation. You know, the do not attempt cardiopulmonary resuscitation decision is a medical decision. Now, when cases like this family are pushing for CPR still to be done, where does the medical duties as the decision maker for CPR end? Where does the family input end? Knowing that you always need to discuss with the family. I know you covered part of it.
Well, these are actually, this is easy in a secular society, meaning the law tells you what you can do and what you can't do. So you could, Julie or anybody else could adduce the law and say, we don't think this is in your mother's best interest, and we're not going to do it. And the likelihood of you being chastised for that is low. You might cause the Third World War, but the thing about let's say that they say, let's make it easier. Let's say they say, I want you to amputate my mother's right leg, and there's nothing wrong with her right leg. You'll never do that, right? You'll never amputate someone's right leg just because someone has a psychiatric delusion that that's what's necessary. CPR is something more ambiguous than that. You can use the secular law to say on any procedure that we're not going to do it, but try and negotiate your way out of this. Try and negotiate your way out and say that this is only going to, if it brings her back to life, it's going to bring her back to life at a lower level. Get help from social workers, get help from nurses. Don't face this on your own. Have a family meeting with everybody involved and sit down with them and try and explain to them what's involved. But again, you can rest assured that neither of these three religions insist on CPR at the end of life for people who are in very, very bad shape. You can, with confidence, say that Islam does not demand it, Judaism does not demand it, Catholicism does not demand it. Sometimes you'll do it, but it's not demanded. I hope that helps.
I hope so. Very helpful. Professor Clarfield, I would like to thank you so much for today's presentation. As I said before, this presentation has been recorded despite some of the difficulties with the sound we had, but I think the message has been very clear, very informative. This is going to be available in our YouTube channel in the coming days, and you will be able to watch it again. I invite you, as Grace just written in the chat, to follow Rich by Nightingale Hammerson on social media in our website, so you get the best information possible with related to care, mainly for the older community. Thank you so much, everyone, and I wish you well. Wish you a good day to everyone. Thank you.
Peace.